Hey guys, I just wanted to take a quick minute and go ahead and since we're not going to have a lot of time in class to cover this, I wanted to cover it here so you can go back and look at things, go back and listen. But this is kind of a big section that I think needs a little bit more time than we're going to be able to give in class. So I want to talk about pregnancy and the complications of infectious disease. So infectious disease is a big thing that can affect a pregnant mom and can actually cause fetal abnormalities. So we're going to kind of start talking about those, but I want you to kind of know, how are they transmitted? Some of them are transmitted perinatally, which is inside mom. There's lots of different kind of things that we can do for that. But I want to kind of start with this first slide here. It's TORCH. And TORCH covers 5 different things. It's kind of an acronym for 5 different things. Toxoplasmosis, other just means hepatitis, syphilis, varicella, and herpes zoster. R is the rubella, CMV is cytomegalic virus, and HSV is herpes simplex virus. So that's what the TORCH stands for. All of these are tetragenic, which means that they can all cause fetal abnormalities. They all cross the placenta barrier. They all affect the baby depending on where the baby is at in gestation. It's going to be more critical in those early weeks, like week 6 through 15. That's going to be a very critical period when multiple things are developing, systems, all that kind of stuff is developing, and any of these infections can be tetragenic to that baby. So sometimes the babies might have intrauterine growth restriction, which means that they don't grow appropriately like they should. Microcephalic, which just means that their brain is underdeveloped. Hepatosplenomegaly, which just means that like their liver, spleen, and all that's going to be enlarged. Thrombocytopenia, so that means that they will be born without a lot of clotting factors. There could be CNS problems, so there could be like neurological complications, seizures, things like that. Cognitive impairment, which is going to be developmental delays, which is going to be intellectual disabilities. Hydrocephalus, so that's just going to mean that they have water on the brain, which could mean that they may have to have a shunt later on in their life. Jaundice, which is going to come from your breakdown of the red blood cells, which kind of goes along with the thrombocytopenia. Hearing deficits. Chorioretinitis just means that sometimes these babies will be born blind. So there's a lot of things that can happen. So the best thing that we can do for these babies is to prevent these moms from getting this, which in turn means moms are going to have to do the prenatal care. They're going to have to take care of themselves. Many times if they get it early in their pregnancy, sometimes they will have just a spontaneous abortion because the baby realizes that it's not viable. Sometimes these babies will be born stillbirth, and sometimes they'll be premature. So there's a lot of things that can happen. So how are we going to diagnose these tests? Well, the best way to diagnose it is we're going to do a bunch of screening tests. So when moms comes to their first prenatal visit, this is one of the things that we're going to do. We're going to do all these serological testing, and we're going to test for all of those kinds of things. CBC, hepatitis antigens, hepatitis B, hepatitis A, all the liver function studies, all of that we're going to do. And then a lot of times this will all be repeated again about 36 weeks to see what we're dealing with. They can also do cultures. So the cultures will show if there's herpes simplex virus and cytomegalic virus. So there's a lot of kind of things. Now, eventually, if they are diagnosed with something like this, there will be a lot of ultrasounds because they're going to be checking to see if that baby is growing appropriately like it needs to be and what deficits are they going to have. Sometimes we can see those defects and stuff on ultrasound. So they'll be watching for all that stuff. So the first one is T, toxoplasmosis. It is caused by Toxoplasma gondii. It is transferred by like undercooked meat, water that's not filtered, feces in the soil. So a lot of moms are told not to change the cat litter box, not to be digging out in a garden without gloves on. Make sure that they are cooking their meat and making sure the meat is thoroughly done. A lot of times they don't have any symptoms, so it's kind of difficult to diagnose this. Newborns with this can present with the chorioretinitis, which could be like the blindness, and they could have hydrocephalus, which means that they have extra fluid on their brain. So talking to your moms about decreasing their, chances. Don't change the litter box, or if you have to wear gloves. Make sure if you're outside doing any kind of work with anything that there could be feces in the soil, they need to be washing everything. All their fruits and vegetables when they come home need to be thoroughly washed. Hepatitis B, this is usually transmitted sexually or by contact with blood and body fluids. We don't see this as much because everybody's been vaccinated now against hepatitis B, so we're very rarely seeing this. It needs to be screened very early in the pregnancy so we know what we're dealing with at the time of delivery. If the mom is positive, this is kind of important, if the mom is positive, that baby needs to get a hepatitis B immunoglobulin vaccine 12 hours after delivery. That will help prevent the baby from hopefully contracting that. And then the babies will still get their 3 doses of the HPV vaccine at birth. They'll get one at birth, one at 1 month, and one at 6 months from birth. So they will still receive all that, but they really need to get that that HBI immunoglobulin to help protect them at birth. Syphilis. We don't see syphilis a lot, but we do see it more than we would like to be seeing it recently. So it is a sexually transmitted disease due to Tremonea pallidum. The bacteria crosses the placenta barrier, so it does get into the baby. It increased risk for mom to have a spontaneous abortion. Sometimes there will be a fetal demise inside mom, which means that the baby dies inside mom. Intrauterine growth restriction, fetal hydrops, which basically kind of means that they don't develop a lymphatic system and they're born, usually that's a fatal kind of thing if they get that. Preterm congenital infections, and a lot of times there will be neonatal death. So this is important that we test these moms right up front when they first become pregnant so we know if they have something like this. Most of infected infants are asymptomatic, so they don't have any symptoms. We might see a few things like the jaundice, the sniffles, long bone abnormalities that we would be starting to see on ultrasound. We're going to screen those moms. It's called an RPR or a VDRL. RPR is what most people will know it by, and we're going to screen them at about their first prenatal visit, and we're going to screen them about 36 weeks. So early treatment is the best thing that we're going to do. It is treated with antibiotics, and it can go away. But syphilis has 3 stages. The first stage appears as like vesicles and blisters. Second stage appears as like muscle aches and things like that. And the third stage actually goes into like a syphilis dementia. So there's 3 stages, and that syphilis dementia can come many, many years later. But if we know it and we can treat it, we can get rid of it. Varicella and herpes zoster. So these are usually caused by the chickenpox vaccine. So one is varicella and one is shingles. So the herpes zoster is known as shingles. So if you have a mom, for example, if you become a nurse and you're pregnant, you should not be working around anybody that if you've never had the varicella vaccine or you've never had chickenpox, you should not be working around anybody that possibly has the shingles or varicella, because it is very tetragenic to the baby. Immunizations has decreased the incidence of this because now most people will get the varicella vaccine. It's required in kindergarten. But the highest risk is for those moms getting it during that second trimester. So they could get low birth weight, the baby could have scarring on their skin, the limbs could be hypoplasic, which means that they're going to be small or kind of nubs, things like that. They could be born with contractures, CNS disturbances, eyes and ears, all that kind of stuff. So a lot of times if moms don't know that they've had varicella, we'll go ahead and run a varicella titer so we know where we're at. Best prevention for these moms is stay away from people who have shingles or varicella. Rubella. We don't see rubella much anymore either because we have the MMR, but it's also the German measles. Many people may be they might not know that they have this, or they might just think, oh, it's really nothing. They might have a low-grade fever. They might get a little bit of a rash. Lymph nodes will swell. That is lymphadenopathy. Just not feel too good. They might even get like some conjunctivitis. But for the fetus, it's a big, big risk. Spontaneous abortions, a lot of them will be born stillborn, preterm deliveries, and lots of congenital anomalies. So, when we kind of got rid of the German measles, it really helped with a lot of the congenital abnormalities that we see our babies born with. There's no cure Again, the best treatment, if you get it, there is no treatment for it. So it's just supportive, taking care of the temperature, making sure the temperature stays down. We don't want any pregnant moms having fever. Once we get over like 100.7, we need to start giving them something to bring that fever down, because that can also kind of cause some fetal growth problems. So cytomegalic virus, we call that CMV. It's also a silent disease. We don't really see this, and a lot of moms don't even know they had it. They might have had like flu-like symptoms for a couple days and just blew it off as being tired or whatever. But you get it through infected body fluids. So any type of body fluids. It can be passed to your fetus, and it gives severe, severe defects. So CMV is something that you really have to watch if you are pregnant. Make sure you're not around anybody that has CMV. But these babies can be born with hearing loss, microcephaly, which is usually underdeveloped brain tissue, seizures, small for gestational age, all of that kind of stuff. No cure. It's basically prevention. You can also have a titer drawn to see if you have had that. Most people have had it in their lifetime. Herpes simplex, which is herpes 1 and 2. It's a sexually transmitted infection. It's spread by direct contact. Usually symptoms, they may be asymptomatic. If it's in remission, they may not have any, or they may have the painful lesions. Sometimes herpes simplex virus never goes away. It will just lie dormant. Sometimes when you're very stressed or your body's stressed, sometimes that virus will come out. But we need to know that if they are pregnant and it's about time for delivery. So most of these, if they're going to get it, they're going to get exposure during that birth canal. When they come through the birth canal, if there's lesions, they can get those on their eyes, their bodies, things like that. So if they actually have active herpes at the time of delivery, they will have a C-section. If they don't have any, then they may go ahead and proceed with a vaginal delivery as long as there are no lesions. Treatment, we give them acyclovir and kind of suppressive treatment. That's kind of suppressive, so it kind of takes away those lesions. So it just kind of depends on what's going on with the mom at the time of delivery. So just the sexually transmitted diseases, I'm just going to cover really quickly, just so you know about those. These are usually done by sexual contact through blood or body fluids. This is your Hep B, syphilis, herpes simplex, chlamydia, gonorrhea, genital warts, trichomonas, HIV, and AIDS, which we've covered some of these already. All of these are reportable to the CDC, and that's how we track like statistics to know how many people have them and how many people in your area have them and what is the biggest known things that are going on in your state. So every state, anytime someone comes in and they test positive for chlamydia, gonorrhea, syphilis, it is reported to the CDC, and that's how we get our statistical information. So chlamydia, it is the most common. It's caused by chlamydia trichomonas. Most women will have no symptoms. So a lot of times they don't have any symptoms, so they delay treatment because they don't have anything going on. However, with a chlamydia infection, that can create problems. That can give you pelvic inflammatory disease. It can lead to infertility because you get scarring of your fallopian tubes, where the fallopian tubes is actually where the baby is fertilized. So if you get, your fallopian tubes around like this and you get scarring all inside there, that the sperm can't get through there and the egg can't get through there, and so you can't have fertilization. So chlamydia does increase the risk for spontaneous abortion, premature rupture of membranes, preterm labor, but we treat it with antibiotics. Gonorrhea, it's caused by Neisseria gonorrhea. Initial symptoms might be kind of mild, might kind of go unnoticed, but we take cultures from the cervix, the rectum, and the throat, and we diagnose that with that just to kind of see where it is. If untreated, it's kind of the same thing that you're going to get with chlamydia. It is going to also lead to infertility because of the scarring that happens in the fallopian tubes. These babies are at risk for ophthalmic neonatorium. Ophthalmic neonatorium is a disease that babies can get when they come through the birth canal and they get exposed to bacteria. That is the number one reason why we give the babies the erythromycin ointment on their eyes when they're born. Every baby gets it, regardless if mom is positive or negative. It just prevents any kind of infections in the baby. And we treat this one with antibiotics also. So HPV, We're also seeing a very decrease in this. HPV is the number one thing that we see women get with cervical cancer. But with the new HPV vaccines, we're not seeing nearly the amount of human papillomavirus that we have seen. It's the most common viral STD, not bacterial, and it's spread by skin-to-skin contact. So it's, we usually diagnose that just by looking at it, or they can do a pap smear and you get some abnormal cells. But it can be passed to the baby during the birthing process. So they're going to kind of look and see if mom has any active kind of things during that. Trichomonas, we see trichomonas. It's an STD, but it's a protozoan, so it's not a bacteria, it's not a virus, it's a protozoa. So it's transmitted. It can be transmitted to the baby through delivery, but it's very, very rare. Symptoms, they kind of have very foamy, yellow-green kind of vaginal discharge. I've always heard it kind of smells like kind of fishy smell or very unusual vaginal odor. Painful sexual intercourse, dysuria, all of that can be it. We have to culture this to see what it is. It can lead to low birth weight, premature rupture of membranes, preterm delivery, and we treat that with oral metrazole. So that's how we're going to treat trichomonas. HIV, it's an STD. We've kind of talked about that in 101, but it's the human immunodeficiency virus. Transmission is unprotected sexual activity, sharing needles, IV drugs, all those tattoos, anything like that we're seeing. Many times individuals may not know that they have it. So again, that's why first prenatal visit, they will get tested for that, and they will get tested again at delivery. It can be transmitted to the fetus through pregnancy, and it can be transmitted through breast milk. So if mom is positive, a lot of times if we're treating baby that hopefully baby doesn't get it after exposure, moms are not to breastfeed if they're HIV positive. CDC recommends, the testing, but they can refuse. Most people don't. So just always keep that in your mind. Goals of treatment for a pregnant mom is prevent the progression of the disease during pregnancy. So we're going to keep a look at those viral loads. We're going to keep a look at, their T counts, their T counts that we're going to be looking at. Prevent any transmission to the baby. And the best way to prevent it is start that treatment early on in pregnancy. So that's very important that they get that started really early in their pregnancy. Okay, that's it. I hope that helped.